Good afternoon, everyone. Thank you for joining today's webinar. My name is Kate Morales. I'm the Senior Program Director with the Hepatitis B Foundation, Director of Hep United. I'm very excited to host today's session on hepatitis B myths and misconceptions. And during this session, we're going to focus on transmission and prevention of hepatitis B. Today's webinar is being presented by Hep United, which is a national coalition of over 40 national and local organizations working across 20 states in the U.S. to increase awareness, testing, vaccination, and lymphatic care among high-risk communities. Before we get started, just to review a few housekeeping items, let you know how you can participate in today's webinar. Everyone is on listen-only mode, and so you are muted during the presentations. If you lose connection on your internet, there is a phone-in option, and the call-in numbers are shown here. You can submit questions at any point, and I see we do have actually a couple already. Feel free to submit them in writing during the presentations by typing them in the question box on your control panel, and we are reviewing them as they come in, and we will then answer the questions at the end of the presentation. And finally, we are recording today's webinar, so we will send an email afterwards, and feel free to share the recording with your colleagues. I'll go ahead and introduce today's panelists. First, we have Maureen Kamishki. Maureen will be moderating today's questions with our experts. Maureen is the Hepatitis B Foundation's social media and outreach manager. She has worked with the Hepatitis B Foundation for over 8 years, developing our outreach and communications network, which includes managing our patient consultation helpline. Maureen is also a storyteller with our Just Be personal storytelling campaign, so be sure to check out her story online. We also have Dr. Pani Perumalswamy. She is an associate professor of medicine in the Department of Medicine, Division of Liver Diseases, and Rekanati Miller Transplant Institute at Mount Sinai Hospital in New York. As a hepatologist, her research interests are in health services and clinical outcomes with a focus on viral hepatitis and liver cancer. And our third speaker is Dr. Amy Shen Tang. She is a primary care internist and the Hepatitis B program director at Charles B. Wang Community Health Center in New York City. She oversees hepatitis B clinical care, research, community outreach, and education to reduce hepatitis B transmission and liver complications among patients with chronic Hep B. And she also serves as the advocacy chair for the New York City Hepatitis B Coalition, where she works with local, regional, and national stakeholders around hepatitis B awareness, funding, and linkage to care. And with that, I will turn it over to Maureen.
Hello. Hepatitis B is the most common serious liver infection in the world. Globally, 292 million people are living with chronic hepatitis B, with the greatest burden in Asia and Africa. Only 10% are aware they are living with the virus. In the United States, an estimated 2.2 million Americans are living with chronic hepatitis B, which disproportionately impacts Asian American and Pacific Islander and African immigrant communities. Last year at the Hepatitis B Foundation, our outreach team addressed over 7,500 questions and concerns from people around the world via phone, email, and Facebook. Often there is a great deal of confusion surrounding hepatitis B transmission and prevention, which can lead to a lot of misinformation, stigma, and discrimination. We're hoping to clear up some of this today with a webinar with Dr. Perumalswamy and Dr. Tang. First, let's get started with a short poll to see who is joining us on today's webinar.
All right, so tell us who's joining us today. If you are joining us from overseas, whether you are an individual personally impacted by hepatitis B or with an international organization, please be sure to click option 2. And you got almost 70% voted so far. Give it another couple of seconds. All right, looks like we got almost 80% responses. I'm going to close the poll and share the results. Great. Oh, we actually got a majority of U.S.-based state or local health departments. And then kind of an even distribution amongst community organizations and health clinics and other. So if you click other, please send a note. Let us know who you are joining, who's joining us. All right. And we'll move on to poll question number 2. Pop quiz before we dive into this question. How is hepatitis B spread? Give it another couple of seconds here. All right. Looks like majority have voted. Close the poll now. Share the results. 95% all of the above. The couple with direct contact with infected blood and mother to child during birth and delivery. Great. Well, I'm going to dive deeper into these answers and turn it back to Maureen.
Hepatitis B is spread through direct contact with infected blood, literally blood to blood, but it's also contained in other bodily fluids, but in much lower concentrations. So this spread of hepatitis B can occur in a number of different situations, such as unsafe injections, medical or dental procedures, unsafe sex, injection drug use, and the most common route of transmission worldwide, which is through from a hepatitis B positive mother to her baby at birth, or through horizontal transmission during early childhood. Fortunately, hepatitis B is a vaccine preventable disease, starting with the birth dose if possible. So let's take a look at our slides. We're going to start up with question 1. We'll move to our first question for Dr. Purmalswamy, which is about whether or not there is any connection with hepatitis B and food, either sharing a meal or eating a meal prepared by someone living with chronic hepatitis B, or anyone that is part of the food chain that might possibly be infected. Is that going to potentially spread to other people? We get a lot of concern about this. There seems to be a concern with hepatitis B and food.
So yeah, this is a great first question to start with, because I do think this is a question that comes up quite commonly in speaking to people who are at risk or people who are already infected. So the short answer is no. There's really not a connection between hepatitis B and food. It's most commonly, transmitted through really direct blood contact. So it's really important to spread the word and inform our communities that hepatitis B is really not ever spread by sharing food, bowls, utensils, or by sharing a meal with someone who has hepatitis B. I do think we're going to talk a little bit about stigma a little later, but there's a lot of stigma around lack of awareness around this issue. So I think this is a really important question or myth, really, to raise awareness around. So it's not something that's spread, through food or any of those modes that I just listed.
Great, thank you. Okay, question 2. This is for Dr. Tang. What about, is hepatitis B hereditary? People often ask, is it hepatitis B genetic? Is it carried on the sperm of a man or the egg of a woman? Some people wonder if it indicates that they have weak genes. Or sometimes we even hear something like, how can I be the only one in my family with hepatitis B? Any thoughts, Dr. Tang?
So this is actually a really common assumption in the patients that I see in my clinic, because people do notice that a lot of members in their family do have hepatitis B and assume that it was probably passed down through genetics. The reason why there is this pattern is because hepatitis B is commonly passed from mother to child or from between household contacts because it's a really quite infectious virus. But it is not genetic. It's not carried in the DNA of the sperm of a man or the egg of the woman. Some people see it run in their family mainly for the reason that I mentioned, that mothers can pass it on to their child during childbirth, and then also because infants, children are more likely to develop chronic hepatitis B infection if they're exposed and infected in young age rather than older age, because their immune systems are less strong, and so they're more likely to maintain the infection rather than to recover from it. The last question about why some people are the only ones in their family known to have hepatitis B. There's kind of two parts to this question. It's very important when someone finds out that they have Hep B that they get all of their family members' sexual contacts and household contacts tested for hepatitis B, rather than assuming that they don't have it because they don't have symptoms. Hepatitis B, a chronic infection, is largely asymptomatic and can cause liver complications over time and lead to liver cancer and cirrhosis without having any symptoms before that happens. And so important that everyone actually gets tested for hepatitis B and not just assume they don't have it because their doctor never said anything. Not everyone gets the test ordered for them just because they're seeing a doctor. The other possibility is that someone is the only person in their immediate family who has the infection. Their mother doesn't have it, their siblings, their parents, grandparents don't have it. And one possible way is that they were infected through contact with blood that was infected with hepatitis B, either through like an unclean medical procedure or even dried blood that was on an object or a toy that they shared as a child. Because the hepatitis B virus can actually live in dried blood for at least 7 days. And we see this sometimes in some countries where, small children are sharing toys that have a little bit of dried blood, and it's very common to have cuts and things and sort of wounds that can be an entry point for the dried blood with hepatitis B virus in it to be passed on to others.
Great. Thank you, Dr. Tang. That was fantastic. Let's move on to question 3. Okay, Dr. Kurumaflami, is hepatitis B spread through all bodily fluids? Can I safely play sports and not be concerned with contact with sweat? How about attending school or working with someone if I have Hep B? I'm worried I'm going to spread it to someone. And what sexual activities are safe for someone with hepatitis B? Does having Hep B mean that I've done something wrong? I mean, some people call us and they've never had sex before and they're just surprised. They don't know. What could they have done wrong? What simple precautions can I take to prevent hepatitis B if the people I love are not vaccinated?
So this is a really good question for us to talk a little bit about. There's certainly a lot of stigma around associated with having hepatitis B virus infection, and still a lot of really myths around how this is transmitted. So I think in the first question we talked a little bit, just I briefly touched on, really needing direct blood contact. We certainly know, as Amy just said, kind of in relation to the last question, worldwide, most transmission occurs vertically or in early childhood, so from mother to child or somewhere kind of in that early childhood, same household kind of phase. In countries like the United States, the most common mode of transmission is certainly sexual transmission, unprotected sexual intercourse being the risk factor there. So we generally, to kind of go down the list of kind of sub-questions here, we usually don't put any restrictions on playing sports. We do not, we counsel patients and people who are infected that you cannot transmit this through the sweat. We There are no restrictions on attending university. One thing I think we should spend a little time talking about is kind of a bit of a disconnect at times. There are certainly cases still, unfortunately, of discrimination in the workplace against people who are hepatitis B infected. But there are laws and protections in the United States in place to really try to prevent discrimination. But despite all of these things that we have in place, it's not uncommon for our colleagues at the Departments of Health and some of the advocacy organizations to hear about cases in which health professionals particularly are discriminated against based on their hepatitis B status. And it's really important for people who are infected to know your rights and know that you can't really spread this just by working with other people. In persons who are infected, certainly sexual transmission is a way to transmit this. So it's really important, and we counsel patients to really use protection to protect their partner and to also really strongly encourage that partners get tested. And the importance of that is that if a partner is negative, we have a highly effective vaccine, right, that we can administer to partners to prevent them from ever, getting infected. And let me go back to some of these sub-questions here. Sexual activities are safe with someone who has hepatitis B. So we just talked about vaccination and the risk of the sexual transmission, how partners can be protected. Does having hepatitis B mean that I'm somehow dirty or have something wrong? So no, not at all. And I would just, again, kind of go back to what I started with here, is that there is a lot of stigma for people living with hepatitis B virus infection. And so we still have a lot of work to do to try to reduce and eliminate stigma around this infection. And then finally, are there, and then the precautions that we just talked about, particularly with sexual transmission and having a highly effective vaccine.
Can you just add on about if there are other precautions about preventing transmission, like in some countries, not everyone is vaccinated. So, just maybe some simple precautions that everyone should take for that if they don't have the option of vaccination.
Yeah, so certainly, we talked about direct blood contact. So trying to minimize exposure if somebody does have an open cut or wound, and, using barrier protection in terms of gloves if available, trying to keep those types of, blood exposure risk factors kind of covered, minimized, and then really the sexual transmission. You are right. There are a lot of parts of the world in which access to testing is still very difficult. Access to vaccinations is not available, although there's been a lot of significant growth in that area worldwide. Does that answer the part of the question?
Yep. Yeah. I mean, we often say to consults, to basically, use their voice and make sure that they ask and make sure that they have, that it's a safe injection, and ask about, particular, devices that are being used and procedures just to make sure that they're safe.
Yeah, so I think you're raising also a really interesting point about the iatrogenic spread, right? And in parts of the world, there still are, on the order of hundreds of thousands to millions of iatrogenic exposures or rates of infection related to unsafe, medical and dental practices, unfortunately, in parts of the world. So, so asking about how you can stay protected, how you can protect others if you're infected is a really important part of that.
And then the only other thing I want to add is if you are a person who has chronic Hep B and you have a cut or some bleeding, to make sure you clean it up with something like bleach, just to make sure that everything is gone, because as we had mentioned, hepatitis B is a highly durable virus in dried blood, and so you just want to make sure that it's completely cleaned.
That's a really good point, Amy.
Thank you very much. Yeah, that's great. We always say 1 part bleach to 9 parts water. Thank you very much. Let's move on to question 4 for Dr. Tang. Dr. Tang, we often hear from our consults asking if it's safe to be in a relationship. They wonder if it's safe for them to get married, or they find out that they're infected, they're married, and they just recently learned of their diagnosis. And they wonder, how is it that my spouse is not already infected? And then you have some that ask, well, gee, should I bother to tell my partner or have them get tested or vaccinated? I mean, isn't it too late? What would you say to that?
Yes, this is a great question. So in my primary clinic, I actually take care of a lot of couples who either both have hepatitis B or only one person has hepatitis B, and these questions do come up. So I'll just go through the sub-questions real quickly. I've never had sex before. How could I have gotten this, and how do I explain to a future partner? So we talked about how hepatitis B is also transmitted from mother to child and then horizontally through blood-to-blood contact. So there could have been another way of getting hepatitis B beyond sex, and so that's just something to think about. But in terms of explaining this to a future partner, the most important thing is trying to be open and honest, because it's perfectly preventable, in terms of transmitting this to a partner if they are, number one, tested, and if they are not already infected, to get the vaccine so that they would have protection and it would not be a concern of transmitting to a partner. The second question, can I marry someone without infecting them with hepatitis B virus? So similarly, if they are tested and it looks like they've never been vaccinated, never been infected, then they can get the vaccine. We can retest to make sure that they've developed antibodies and protection, and we assume that the vaccine provides lifelong protection, that they wouldn't need boosters or wouldn't wane over time, and that they would not be infected from that point moving forward. The third question, I am married and recently learned that I have Hep B, and my spouse was tested but was not positive. So how can this be? So we did talk about how Hep B can be sexually transmitted, but it doesn't necessarily mean that all sexual encounters lead to Hep B transmission. So there's actually a lot of factors that come into play. For instance, the level of virus that a person has in their body. So if they have a very high level of virus, they're probably more likely to transmit during sex than someone who has a very low level. And there is this very wide spectrum of Hep B viral load levels in people who have chronic hepatitis B. The other reason might be because when we talk about Hep B transmission, there has to be what we call like a portal of entry for the virus to enter someone else's body. So there has to actually be a break in the skin or mucous membranes of somebody who would get infected with Hep B. If there isn't, then there's no way that the virus can enter another person's body. So even though hepatitis B is found in blood and in some cases sperm, there has to actually be an opening in the skin, a break in the skin to enter someone else's bloodstream, and that doesn't always happen. And then the last part of the question is, why should my partner get tested or vaccinated? Isn't it too late? So they don't necessarily. So as we mentioned, not everyone who's had sex with a partner will get the infection, and so it's always good to check someone's status in advance. And if they have never been exposed before, never been vaccinated, then they should get the vaccine, because that's a way to prevent infection in the future. I do want to also share a patient story that I think can really help illustrate some of the concerns that people have. So I take care of a husband and wife, and the wife is interested in having a child, but was worried because her husband didn't seem to be interested in her sexually, and so I was also caring for the husband and who has hepatitis B, and I was talking with him, and he had mentioned, it's because I haven't told her that I have Hep B yet, and I know that you tested her and she wasn't infected, but she also hadn't gotten the vaccine yet, and I just wanted to wait until she finished her vaccine to have sex. And that's definitely that's or not to have sex, but to have to try to conceive. So in these situations, it is fine for the man to wear a condom and to have sex, but if they're trying to conceive, it is probably better to wait until the wife is fully vaccinated and has gotten tested and has detectable immunity in response to the vaccine. And so I tried to encourage him to talk with his wife about his diagnosis. He had some concerns about her telling the rest of his family abroad. And so, it is a personal decision of his. I'm caring for both people, and will make sure that the wife is completely vaccinated and that we do retesting to make sure she is protected, and hopefully they can continue to explore their disclosure. But it does affect people's relationships. It is true.
Yeah, it sure is. It's quite a journey. Thank you for that story, Dr. Tang. Okay, so we're going to move on to question 5. Can I have children without infecting them with hepatitis B? How can I protect my baby? Can I safely breastfeed my baby? In many parts of the world, the pentavalent or other combination vaccine series is provided and is given weeks after birth. Can I wait to vaccinate my baby? So can I wait 6 weeks for the pentavalent vaccine? Dr. Puruswamy?
So I think we kind of spoke a little bit earlier about kind of worldwide, there's a lot of transmission of hepatitis B, what we call vertically, or from mother to child, and or an early childhood phase, which is it's a really important kind of mode to spend a little bit of time talking about here. So, certainly in the United States, we try to universally screen all moms who are pregnant women, pregnant women, for hepatitis B infection to be aware of what their status is. And in those that do test positive, it's really important that we do what we can, and there are things we can do to try to protect or reduce the risk of transmission from mom to baby at the time of birth. So it's actually recommended that hepatitis B birth dose vaccine is administered, but you should not wait, as one of the sub questions kind of talks about. It's really important that actually what's endorsed by the World Health Organization, the American Association of Pediatrics, is also to do that vaccine within 24 hours of birth. So it's really important. And, there have been some studies to look at how good of a job that we're doing here and elsewhere with administering that birth dose vaccine. And I think there's certainly room for improvement even in places in the United States. So sometimes it's given before discharge, but really the recommendations are to give it as soon as possible within those first 24 hours of birth. So that's important. Now, in terms of what additional things we can do to try to reduce transmission from mom to baby is a prophylaxis with hepatitis B immunoglobulin. And this offers protection for the baby for up to 6 months while that immune system is still trying to get its feet off the ground and develop and mature. And so certainly the biggest benefits are in women who test E antigen positive, with reducing the risk of vertical transmission, and that immunoglobulin can be given really ideally right after the baby's born, before they leave the hospital. Now, so giving the first birth dose vaccine is really helpful, but it's recommended to really complete a vaccine, a whole series of vaccine, in order to have that lifelong protection or immunity to hepatitis B. So it really goes beyond just getting that first birth dose in the first 24 hours, and really completing, a 3-dose series for which there are established schedules to administer the vaccines. As of, I think, next year, the Global Alliance for Vaccine Initiative, along with others, have really done a lot of work to trying to increase the availability as well as administration of providing hepatitis B vaccines at the time of birth. And there's been a lot of growth over the last decade in availability and administration of that vaccine. I can't stress enough about how really timeliness of giving that within the first 24 hours is pretty important. And then really important to also know what other things can be done or should be done. And so part of this, again, is screening the pregnant women. And if you are infected, really doing an assessment to try to figure out, what's your viral load, what's your E antigen status, because these things confer risk in terms of rate of transmission at the time of birth to the baby. So, knowing what the mom's Hep B DNA viral load is, for example, and to see if they meet criteria to administer or recommend administering antiviral therapy in the late second or third trimester of pregnancy. Another question that often comes up, the sub-question 3 is hepatitis B virus transmitted through breast milk? And the answer is no. Certainly, the only time we actually encourage women who have hepatitis B to breastfeed. The only thing to be cautious or to raise awareness about is if there's obvious bloody discharge in the breast milk, then breastfeeding should not be done, and or mastitis or cracked nipples at the time of breastfeeding, because these things can lead to direct blood exposure. So other than that, we don't really recommend any restrictions around breastfeeding, given all of the other benefits and lack of risk of transmission there. And then I have hepatitis B and will soon be a father. Do I need to wait until my baby is vaccinated to hold it? Maureen, can you clarify that question for me a little bit?
You'd be surprised how often we get this question. The mother does not have Hep B, and the father is terrified that he's going to pass the virus on to the baby. So he's afraid to hold the baby. They'll ask, can I hold the baby? Is it okay to be with the baby? Yeah.
Right. So physically hold the baby.
Physically hold the baby.
Yeah, there's no restrictions on that. We want to encourage a lot of, direct contact between the caregivers and the newborns. And so there's really, again, no restriction. I think this kind of goes back, Maureen, to the issue of stigma that we've kind of start to talk about. And you really need to provide a lot of reassurance. There's a lot of data on the benefits of skin contact between mother and newborns, father and newborns. So we certainly really try to encourage that.
Yeah, once again, I think there's just also confusion as to who is transmitting the virus and maybe not understanding that it's more of an issue when the mother is infected versus the father. But yeah, there is a fear for the father too, that he'll transmit it to his child.
Yeah.
So, anyway, thank you very much. That was great. Let's move on to question 6. Dr. Tang, is the hepatitis B vaccine helpful to me if I already have hepatitis B? Will it help me or even cure me? We have a lot of consults that will ask this. Will it cure me? What if my partner has hepatitis B? Do you recommend an accelerated hepatitis B vaccine schedule, or something other than the standard 0, 1, and 6 months, unless you're using the 2-dose HEPLISAV vaccine? Do I need a 4th dose if I'm using the accelerated schedule? What if I'm off the standard schedule? I've been told I don't have antibodies and I'm not protected. I know I finished the series. How could this happen? Should I get a booster shot? How can I prove that I'm protected? And your thoughts, Dr. Tang?
Yes, yeah, great questions. So the first one, I wish the Hep B vaccine was curative, but unfortunately not that simple. So the Hep B vaccine does not provide any benefit for someone who is already infected. There fortunately are a lot of pharmaceutical companies right now who are doing research for Hep B cure, but the vaccine is not the way to achieve that. The next question, a little bit more complex, about accelerated vaccine schedules that exist out there. So the conventional schedule is getting the vaccine the first and second a month apart, and then the last one 6 months from the first vaccine. If somebody gets an accelerated schedule that's sooner, it doesn't necessarily provide them with long-term protection, and so it is recommended that if they were on some sort of accelerated schedule that they do get a fourth dose at 1 year. And in the meantime, practice safe sex and take precautions as much as they can. It's important to note that, especially since this question is about a partner, that the person get a post-vaccination serology test after they complete their vaccine series to make sure that they've developed antibody from the vaccine, and that's usually done between 1 and 2 months from the final vaccine. And this can really provide reassurance for someone that they're protected for life. The third sub-question is, I never returned for a dose of the hepatitis B vaccine. Do I have to restart the series? And the answer to that is no. You just pick up where you left off. So, for example, if you got the first vaccine and it's been a year and you didn't get your second one, you can just get your second one and then get the last one as recommended for the intervals with those. Or if you didn't get your last one and it's even been as long as 3 years, it's okay to just get the last vaccine at that time. You don't have to start over. And then the last sub-question, I'm fully vaccinated. Do I have to get a booster shot? My blood test shows that I'm no longer protected. So this is actually a very common scenario, and it is a little bit more complex to understand. So at least in the U.S., since the early 1990s, the U.S. government had recommended, and the CDC had recommended that all infants and children get vaccinated for hepatitis B with the 3-shot series. And the issue with this is that a lot of these people who were vaccinated early on, who are now, let's say, in their late 20s, or potentially in their late 20s, are now getting tested, let's say in an STD clinic, and it shows that they don't have any detectable surface antibody, even though they actually have documentation that they received all 3 vaccines. So in this situation, what the likely reason is because their antibody levels have decreased, the detectable antibody levels have decreased with time. But studies have actually shown that if these people are exposed to the virus, either through like a real Hep B virus or the vaccine, that they'll have like an immunological memory called an amnestic response, and they will develop more antibody just from that sort of reminder or exposure. And that was, something that they were capable of even before the challenge dose, because it's just that the titers, the level of antibody has decreased, but it doesn't mean that they're not protected. So it's hard to really figure out who are those who just never responded to the vaccine and who are those who just have a what we call a waning titer or level of antibody. So if they're high risk, like if they're a sexual partner of somebody with Hep B, or if they're a healthcare personnel, or someone who has a suppressed immune system, or someone on dialysis, then they should most definitely get at least a booster dose in that setting, and then they can get retested 1 to 2 months after that dose to see if they've developed antibody response just to that one dose. And if they haven't, they can complete the rest of the series. But it is a specific scenario.
And Amy, the only thing I would add to that is that there is no routine kind of recommendation for routine post-vaccine testing to see if you've developed antibodies. There are these specific situations where you might need it for professional school or admission to show documentation, healthcare professionals, for example. That aside, in addition to that, kind of from a clinical standpoint, certainly in patients who have other chronic liver diseases, who may be immunosuppressed, who may be wanting reassurance, as you just said, there's that ability for us to assess, for detectability of the protective surface antibody in these people.
Mm-hmm. Yeah, and if that test is done, even though it's not routine for all the population, but if they do get that testing pretty soon after the vaccine is completed, and they do have detectable antibody at some point, then the assumption can be made that they're actually protected for life, even if in the future they're retested for some reason and they no longer have that antibody detectable.
Yeah, so they can have waning, right, as you kind of discussed. But for most people, they will be protected lifelong.
Yeah, and we're happy to answer any follow-up questions about this because this concept can be confusing to a lot of people.
Yeah, we get a lot of consult questions about this, since we don't, you don't do follow-up testing in general. So a lot of times it's, a college student that's going to nursing school, dental, or medical school, and they want to know, why their vaccine isn't good anymore, since they don't have any antibodies. So yeah, we run across that quite often. Thank you very much. Shall we move on to question 7? We have a couple more questions about testing and vaccination. We hear this a lot. I'm from a country where hepatitis B is very common. Should I get tested first or should I just get vaccinated? Is it possible for my partner to infect me even if I've already completed the vaccine series? There's a lot of concern with that. And finally, why should I even bother to get tested? If there's no cure, people are concerned since there's no cure or treatments are lifelong and expensive. I mean, should they really even bother to do it? Any thoughts on that?
I think it's pretty important, to think back again to what the guidelines are around who we should be testing, who might be at risk, or screening for hepatitis B. There was a really great study, and there have been several since then, years ago, done in an at-risk community. It was an East Asian community in California, where they had participants, East Asian participants, kind of say whether or not they had been previously vaccinated and also offered screening. And they found that a lot of, I think up to 15%, between 10 and 15%, had actually given a history that they had been vaccinated against hepatitis B, but actually turned out they were positive for Hep B infection. So I think kind of in terms of that first question, thinking back to who we should be testing for Hep B, making sure that they're screened first, and then if there's an opportunity for protection through vaccination, offering that is the approach really from a public health standpoint. So if you meet screening kind of criteria for just for being at risk for Hep B, then testing first and then vaccinating next is the best approach.
I actually want to add real quickly to that our health center in New York City, Chinatown, did a study where we found that in all the patients, we pretty much screen almost all of our patients in this clinic because we largely see patients who are born in Asia. And we found that more than half of our patients had actually been either infected currently or previously with hepatitis B, and they're all from endemic regions. And so none of these people, if they had just gotten vaccinated up front, would have benefited from the vaccine if you're already infected or had prior exposure. And so that's another reason. If you're from a highly endemic area, you're maybe more likely to have been exposed and perhaps developed antibody from that exposure, rather than to have never been exposed and never vaccinated.
I would agree with that too, with some of our consults where a lot of them are coming from, high prevalence areas, and the vaccine is very expensive for them. It seems like it would be better for them to be tested. They may not need to be vaccinated, and it's always good to know your status.
Absolutely. That's an important point.
I think that's it's a tough call, but I think it's still important to know your status. I mean, would you recommend that people that have been that find out that they had a past infection, what would you recommend that they do?
So it does happen a lot in our patients. What we do is we counsel them that they were previously infected or exposed to the virus at some point in their life, but in most cases, they developed their own antibody levels. And so this really only becomes an issue if in the future they need to go on an immunosuppressant medicine. So there are certain medicines out there that really suppress the immune system and can cause the hepatitis B virus to become reactivated. So hepatitis B virus, once you're infected, it actually is one of those viruses, much like the chickenpox virus or shingles. It never leaves your body. It becomes, as we sometimes say, dormant or sleeping in the liver. And so for those previously infected, where it's not in the bloodstream, but there's, the testing shows that they were exposed or infected in the past, it's only an issue if they're on these specific types of medicines that suppress the immune system. So not if their immune system is down and they're sick, but if they're taking specific medicines like rituximab. There's a lot of new targeted immunologic therapy that's even used for some chronic conditions like asthma, COPD, inflammatory bowel disease, even some dermatologic conditions, and those are also ones that could potentially cause reactivation. So it's always good for them to inform their doctors if they're prescribing that type of medicine that they were previously infected.
Excellent. Thank you so much. We're going to move on to the next part. We just have a couple of, summary, a slide here on what we've gone through about how hepatitis B is not spread casually. You don't have to worry about holding hands, hugging, kissing, sneezing, breastfeeding. That's not going to spread hepatitis B, that it's really spread through direct contact with infected blood. It may be in other fluids, but typically it's that blood or at least direct contact, with blood or the infected fluids. And to, basically, ask that it could happen with unsafe injections, medical or dental procedures, sexual transmission, making sure that all pregnant women are tested for hepatitis B. CDC and WHO both recommend that all babies be vaccinated within 24 hours of birth and complete the series according to schedule. And then that there's no connection between hepatitis B and any part of the food preparation or sharing of meals or that whole cycle, and that there's maybe confusion with hepatitis A, that they're totally different viruses. And that, the importance of the hepatitis B vaccine and how it prevents Hep B transmission, so I mean, and what it could do for you, and the importance of being screened first, especially if you're at risk, come from a highly endemic area, it's important to get screened for hepatitis B prior to vaccination. So we have about 10 minutes left, and we do have a number of questions here. If you guys are ready to take some of those questions. I'm going to start with the first question. If I have sex with my partner by using a condom after the first dose, will she get the infection or will she be protected? I guess basically an idea of what sort of protection you have after each dose might be helpful.
So I can just go ahead and say that what we do recommend is using condoms until somebody does complete their vaccine series. So that is the right thing to do. And as long as there's no break in the condom, there's nothing to worry about. in terms, I actually don't have the exact numbers in front of me, so please correct me if I'm wrong. But I think after the first dose of Hep B vaccine, the average protection is maybe around 60%, and then after the second one,
it's 80. Yeah, it's 50% with the first, 80% with the second.
And then 90.
Yeah.
97.
Yeah, it's actually up to, all of them say up to 50%, then up to 80% because everybody's unique.
Yeah. I also I don't think we mentioned the new vaccine called Hepatitis which is a 2-dose vaccine that's administered one month apart. So if anyone has the means of getting that new vaccine and want to complete their vaccine sooner, it is available in the U.S. At certain clinics.
Thank you for that. One person was asking about horizontal transmission. They were wondering if you could provide a couple of examples about horizontal transmission that occurs in children.
So I think.
Oh, go ahead, Tawny.
Yeah, so I mean, I touched a little bit about kind of early childhood transmission. So it is recommended, members if you live in the same household of somebody who's hepatitis B infected, that there could be, and I think Amy, you had kind of illustrated some of the risks when you were talking about the myth around genetics and Hep B and how it's not genetically transmitted. But it's a durable virus. It can survive on the surface of hard surfaces for 7 to 10 days. It's a pretty sturdy virus, and so we think that there are these kind of not very we can't pinpoint them all the time, but the early kind of childhood transmission, when again, your rate, if you're exposed as the younger you are, the higher the risk of developing chronic infection kind of long-term is, related to, how your immune system is developing or at what stage it's at. And so we do think that there is this early, childhood transmission risk factor, and that's likely more of this horizontal, if you will, kind of route.
So some examples are like if there's dried blood on a toy that's being shared between children, and then one child has like a cut or a scrape, and so that dried blood sort of enters that way. We also usually recommend not sharing toothbrushes and razors because those can sometimes have dried blood on them. So if somebody with Hep B has a little bit of blood on their toothbrush and someone else in their household uses it, and they have a little cut in their mouth as well, then it can transmit that way. And then same thing with sharing razors. If there's, dried blood on the razor and someone else is using it and they have a cut in their face or their leg or something, it can transmit through that way.
So those are great examples, yeah.
Okay, I'm going to go with another question. Can individuals get infected from sharing a drink if their gums are bleeding? Same idea with utensils, if they have bleeding gums.
So probably an unlikely scenario, but if there is blood involved and the receiving person hasn't been vaccinated before and hasn't been infected before, and they have an opening that blood can go into, then that is theoretically possible.
I agree with Amy. I think this is where, again, knowing that this virus, is primarily, transmitted through blood, it's important to just kind of use some common sense here that if there's active bleeding in any way, to do what you can to try to, protect others from transmitting this.
Thank you. I'm looking at some more. Has there ever been a case of a pregnant woman passing her Hep B onto her baby in utero as opposed to during the birthing process?
That's a good question. I'm not sure we have the definitive answer because we don't do Hep B testing in utero.
Yeah, wouldn't be able to know if it was in utero or if it was during the delivery process. Yeah.
Okay, thank you. Sorry. No, go ahead.
Well, I think that it's most of our knowledge is that the hepatitis B is really through the delivery process and the blood that is exchanged at that period of time. Even though we don't have studies on when exactly, a baby was infected with Hep B, we do know from the numbers that for babies who get the hepatitis B hepatitis B birth dose plus the hepatitis B immune globulin, which is given to infants born to Hep B positive mothers, that they have like a 95% chance with just those vaccines at birth of being protected from hepatitis B and not developing it. That other percentage, like the about 5%, are from infants born to moms who have a very high virus level. So we use the cutoff of 200,000 international units. And it's unclear if for those patients if those children get infected because of in utero or through delivery, although we believe it's through delivery because when we give antiviral vaccine or antiviral medicine to the mom, in her last trimester of pregnancy to lower her virus level, we're able to prevent really any possibility of infection through that means. So it really argues more for that it's more in the delivery process.
Thank you. That's very interesting. We're coming up on the end here, I think. We'll take a couple more here. Let's see. Some of them are about treatment. See, are there resources in Philadelphia for low income or no income and uninsured individuals who are positive for Hep B? Can they get access to treatment at free or low cost? That might not be applicable here. Sorry, I'm trying to read through these two.
I'm pretty sure there's a Hep Free Philadelphia campaign that through the Department of Health and local organizations. So I'm positive those resources do exist.
And some of the drug companies have patient assistance programs where you can get the medications, pretty much at no cost if you can fill out the paperwork and submit it. So I think there are some options there.
There's a question about a pregnant mother who was surface antigen positive, and it was documented in her prenatal record that she got it from her aunt who breastfed her while her mother worked. This person was wondering if that's possible.
Could you repeat that one more time?
The person recently had a pregnant mother who was surface antigen positive, and it was documented in her prenatal record that she got hepatitis B from her aunt who breastfed her while her mother worked. She wondered if you could explain that.
I think it's
possibly
possible
gotten Hep B
for people to get infection through horizontal transmission from household contacts or family members that they live with. And so, but I think it's less likely to have been through the breast milk and maybe more likely through dried blood or other sort of blood-to-blood contact that, maybe was not obvious at the time.
And the only thing I would add to that is that, we don't have any tests to really tell us how it was transmitted or how long somebody's had a virus. So the best we try to do is try to kind of call together what might have been a potential, risk or a likely risk based on the history that we get. But unfortunately, there's no tests we can do to definitively say that's how she got it and when she got it.
Yeah, that's actually very common with a lot of consults. It's hard. People want to know why they're infected, but it's a journey, and I think you have to kind of get past that idea of it, and that and just accept it and move on from there and take hold of your health and do the things that are best for you.
Yeah, and also to repeat that hepatitis B is not transmitted through breast milk.
Yes, absolutely. We did have a question if you're willing to address whether or not hepatitis B can be cured. That's probably the last question we have.
So currently, no, there are a lot of good antiviral options that are once daily and well tolerated that will make the hepatitis viral level undetectable, and so less likely to cause any damage to the liver and to decrease the risk of liver cancer. But there's no cure to sort of make the virus leave the body completely. But there is a lot of research right now going on to try to find that cure. So we're optimistic that hopefully in the next 10 years there will be an option.
Okay, great. So looks like we are out of time, unfortunately, but I wanted to just thank you so much, Maureen and Amy and Tani, for this really, really important conversation. As you know, we've seen these numerous questions, and along with the questions that we have gotten over the chat, it's not black and white, and there are so many nuances and questions and myths that are abound about hepatitis B. So I think this conversation is really helpful in clarifying a lot of those questions that people have on their minds. And I know that there are actually a lot of questions that we were unable to get to today, but don't worry, we will be sure to get back to you by email. And if there are any other additional questions or follow-up questions or issues that you'd like for us to address, please don't hesitate to contact us. Our email is on the screen at connect@hepiunited.org. And I wanted to let everyone know that this webinar is recorded, so if you'd like to go back and listen to any of the questions to clarify anything, you will be able to do that. Please be on the lookout for an email with a copy of the presentation. The PowerPoint will be shared, as well as the recording of the webinar. These will both be posted on our website at hepiunited.org as well. And before you leave, as you leave, there will be a survey that pops up. Please take a minute and share with us your thoughts on the webinar today, so that we can continue providing you with any topics that you'd like to hear in the future and improve our webinars for you. Again, thank you so much, Maureen, Dr. Amy Tang, and Dr. Pani Purwalmi, and thank you everyone for joining. Have a great day.
Thank you.
Bye-bye.
Bye.